Can we begin with that breaking news out of the UK that Tessa was just reporting on? A death in the UK of the first death of a person known to be infected with Omicron. What does that change?
Nothing. It's expected. We have a population of 15.8 million in Gauteng in South Africa, and we see right now in hospital deaths roughly 20 per day at this population level. That's all Omicron. Of course, people will also die of it. That's expected.
So, in terms of the perception, what we've heard, perhaps indications that it's milder than the other variants we've dealt with to this point, it's not benign.
People were catching at straws. We need to be aware of that. For a situation like South Africa, it is milder, most likely. Why? Because more than 90%, probably 93% of the population in Gauteng is immune either through infection or through vaccination partially. For people who have reached some immunity, it may well be milder. We don't have any evidence to suggest that it would be milder in the roughly 20% of people in our province in Ontario who were never infected and got never a vaccine. That's the big challenge.
So part of why we wanted to speak to you this morning, Dr. Jüni, is because of what is up now on social media, some of the new figures on Omicron that you are following on your dashboard, and it's given us pause. And I'd like to work through some of these headlines with you. It says, some key figures, the reproduction number for Omicron is 3.32, and you've put 3 exclamation marks behind that, compared to 1.27 for all variants. So reproduction, if I'm getting this, that's the number of people infected by one person. So one person sick goes on to infect 3.32 people. Why is that significant?
This was Rob Steiner, our heads of communication, who tweeted that, I guess, this morning. The point here is that we just need to be aware of, given the immunity that we have in the population and given the public health measures we're having, this thing is roughly 3 times as transmissible as Delta. Meaning the doubling time we see here is exactly comparable with what we see in the UK and everywhere else. Nothing of that was a glitch. We saw it in Gauteng, we see it in the UK, we see it in Denmark. Doubling time is 2 to 3 days, meaning the cases double every 2 to 3 days. And this week we will reach or may have reached already, it's not completely clear, 50% of cases caused by Omicron in Ontario.
This week, because the number, again, on your dashboard is currently 21% of Ontario cases, up to 50 by the end of this week.
Exactly, yeah, this goes very rapidly. Remember what we talked about initially with Gauteng, that it took 3 weeks for them to make it from 5 to 95%. We see exactly the same here.
So how long then are you anticipating before it's, 50% in just a matter of days, and then upward from there, do you expect?
Yeah, of course. It will reach 95% very swiftly within a week or 10 days. Once we're at 50%, we will see that growth will be taken over. The epidemic curve will be taken over by Omicron. So we will see acceleration of case growth by the end of this week.
So Boris Johnson in the UK called it a tidal wave of Omicron. Is that a fair assessment of what to expect?
Unfortunately, yes. We need to be aware of that. We haven't been there, and people are unable to imagine how fast this goes. That's a real challenge here. Now we need to let go first of the myth of this is mild. So that's important.
The big question I might have this morning is, why does it grow so quickly? Do we know that, Dr. Jüni?
It's a combination, most likely, of 2 things. One is intrinsic transmissibility. It just transmits even better than Delta. We don't know by how much. But the other part, which is so tremendously important, is it evades the immune system, meaning people who are infected or people who have been vaccinated with 2 doses, but longer than 3 months after the second dose, they are nearly as likely as somebody who is non-immune to get infected. And that basically just drives this completely.
So that points to exactly something else I'd like to ask, again, up on your dashboard. And it's a graph that shows the percentage of Ontarians over the age of 5 who have 3 doses. It is currently 7.9%, so not even 8%. The data that we got out of the UK on Friday, this real-world data, so not laboratory-generated data, which is everyone saying is very significant, the protection, 70 to 75%, comes with 3 doses.
Absolutely.
Much less under. So what we're seeing in this country is very few people have that 3rd dose, correct?
So first of all, those of us who are less than 3 months after the second dose have derived still quite a bit of protection based on the data from the UK. And I believe those data, it's all very consistent. But then we just need to be aware of that. What we're doing right now is we need to massively boost our third dose rollout, to get up. But all of that will not be to control the pandemic at the population level right now. It's just that we try to protect as many people as we can with the third dose. Remember, if you have had 2 doses, it will still be very protective against hospital admission, but it's not 100% protective, so people really need to be careful now.
So some degree of protection for hospitalization in the most severe cases, even with the 2 doses, but third dose now is the standard that we're looking to. So
absolutely.
This continues to evolve, and just as anecdotally, the portal in Ontario is crashing this morning with people trying to get online to book appointments for third doses, we're hearing.
Absolutely. I'm just missing my slot because I'm on interview here, so I can't book my third dose because of you, Heather.
Sorry, Dr. Jüni. We got to get that you get that third dose so you can stay safe and well and keep telling us about what we need to know about Omicron. Where do we go from here with this variant, Dr. Jüni, do you think?
Look, it's very challenging right now. We need to be aware of that once more. We cannot control this with the vaccine rollout. This will go too quickly. Imagine if these case numbers double every 2 to 3 days. This goes very fast. So we need measures in place immediately just to make sure that we sort of are able to deal with it. And we need to make sure that we just basically secure what is important. That's the hospitals and the long-term care homes and the retirement homes. Loads of vaccines, loads of rapid testing, and we need to make sure that this stays functional as well as it can. We also need to be aware of, that we need to look into triage protocols for the ICUs as well. There will be a lot of things happening right now, and it just depends on how fast we can move. The point is, one thing after the next. Everyone can contribute. It's very simple. What worked before works again. We have less protection against infection right now after 2 doses. That's true, but we continue to have good protection, most likely, for hospitalization. But what is important now, the only thing that really works is if everybody has all, just contributes here and just says, okay, we now decrease our contact rates massively. We see less people, we work from home, etc. This doesn't have to go back to where we were a year ago or something. That's not the point. But we need to dramatically react right now, because I agree with the people in the UK. It is a really massive wave coming.
I think you said something very quickly that's important to hear at this point, at this time when everyone is so fatigued with the pandemic and the feeling that we might be back at the start of yet another massive wave. Just building on what people know already and boosting vaccination as quickly as possible. Is that what you're saying?
Exactly. Use good masks. Stop going into crowded places indoors. Just stop it completely, and really have small gatherings, all of that. If everybody just follows and just says, okay, I see there's a problem coming, we brace ourselves and we just immediately change our behavior, then it's just basically on the population level we can do that. That's what we need. That's why we need to have this discussion right now. Let go of the myth it's mild. We don't know any of that. We will see what's coming. And we can't wait, since it doubles that quickly every 2 to 3 days, the picture of a tidal wave is correct.
The virus is formidable. Don't wait to act. That from the WHO, and you've certainly emphasized that point. Dr. Jüni, as always, we appreciate your being with us this morning.
Thanks for having me again.